Okay, we are just gone past 11:30, so in the interest of everyone that has joined, we will now begin the webinar. So good morning, everybody, and welcome to the Curve Group's webinar today. So this is all around sustaining mental health and wellbeing as employees return back to the workplace. So as you can imagine, quite a hot topic at the moment. So let's go into the webinar for a little bit about us. For those of you that don't already know us or you're not familiar with the Curve Group, we provide HR and recruitment outsource solutions across the entire employee life cycle. These are fully configurable to meet your business solutions, and we will work with businesses of all shapes and sizes, really. We can be your HR and recruitment team, or we can jump in to support your existing teams when you have peaks in volume or need additional expertise. And what you'll see on the screen now is just our wheel of everything that we can do. And behind each one of those categories, there are lots of different areas that we can support you with just as way of information. Here at the Curve Group, we are extremely proud of what we do, and this is just a small token of some of the ways that we've been recognised and all of the accolades that we've received. We are very proud of everything that we do, and I think one of our most recent ones around best customer focus and workplace wellbeing is one that we are very proud of and actually ties in very nicely to today's webinar. So let's take a look at what's coming up. So we're going to be looking at how to define wellbeing and why bother. We're going to look at the impact of COVID-19, the benefits of a long-term wellbeing strategy, how to develop your own wellbeing strategy and initiatives, a very simple to-do list just to get you on your way. We'll focus on some key pillars which will support employee wellbeing. We'll have a look at measuring the impact, and then, as I've already said, there'll be the opportunity for you to ask Q&As. So just before we get into the body of the session, just a couple of things really from me. I've already said it once, but today's webinar is being recorded, and following today's session, once it's downloaded from the cloud, we will automatically send you the link so that you've got reference material to refer back to it. We've built in plenty of opportunity towards the end for Q&A, but at any time, please do pop any questions in the Q&A facility, which can be found on your toolbar, or even use the chat bar, and between myself, Caroline and Laura will ensure that your questions get answered. So without any further ado, let's just do some introductions. So running the webinar and the body of the webinar today is Caroline Harper, who's the head of our employee relations, and Laura Burden, who's one of our employee relations advisors. So what I'm going to do now is hand over to Laura, who's going to kick us off. Laura, over to you.
Okay, so let's start by looking at how we define well-being. So well-being is defined by the Oxford English Dictionary as the state of being comfortable, healthy or happy. Well-being, of course, as Anna has said, is very high on the agenda, and we don't expect this to change for the foreseeable future. The CIPD Health and Wellbeing Report 2021, the survey results showed that just over 3/4 of respondents believe that their organisation actively promotes good mental wellbeing. And that's up from 58% last year, which is encouraging, although just half believe it's effective in tackling workplace stress or in identifying and managing the mental health risks arising from COVID-19. So why bother? Well, research shows that despite more organisations stepping up their efforts, half still don't have a standalone wellbeing strategy. Now, despite more organisations stepping up their efforts, half still don't have the strategy in place. Apart from having a fundamental duty of care for the physical and mental health and well-being of workers, there's many reasons why you should take some time to focus in this area. The latest official data shows that 32.5 million working days were lost to work-related ill health in 2020, with stress, anxiety and depression accounting for almost 18 million of these, so it's quite high. According to the CIPD research, mental ill health and stress are 2 of the top 3 causes of long-term absences. In addition, the coronavirus pandemic has raised concerns about people's health and well-being to the forefront of the agenda in the workplace. So as employers, we've had the role of protecting employees from the risk of infection by putting in place measures such as social distancing, supporting employees to work from home where possible, or putting in place vital safety measures for site-based workers such as health and social care staff. There's also evidence of unhealthy working practices, such as presenteeism, so working when unwell, and leaveism, so using annual leave and time off for catching up with work, something which can be at the detriment of your employees' mental well-being. Now, as we've just mentioned, the coronavirus pandemic has brought employees' health and well-being to the forefront of the business agenda. But what impact has this actually had? So the implications of the coronavirus outbreak for everyone's health and well-being, including mental health, are significant. And we're talking about both during and after the pandemic. More than 80% of organisations were concerned about the impact of COVID-19 and the restrictions imposed on their workers' mental health. Again, that's according to the CIPD Health and Wellbeing report. And this is definitely something we've witnessed across some of our clients. So we've had concerns raised for situations such as individuals feeling isolated due to living alone and working from home for extended periods of time, increased anxiety due to employees' concerns for their own health and that of their friends and family as well, and also anxiety around returning to the office. So as employers, it's crucial that we've got a holistic framework in place to support our employees' well-being. And that, of course, is why we're all on this webinar today. So over to you, Caroline.
Thank you, Laura. So we've heard from Laura about why well-being should be high on the agenda and the benefits of this. So we'll now look at the benefits of implementing a long-term wellbeing strategy. So there are a large number of benefits that can come, and you can see these on the slide now. So first of all, increased employee engagement, which we know leads to optimised productivity, and it also unlocks discretionary effort from employees. Employees that feel well looked after will always perform better. Looking at a positive workplace culture, let's face it, why wouldn't you want this? You often see a decrease in sickness absence when people are healthy and happy. And you become employer in choice, and I'm sure that many of you have seen that attracting talent in the current market is very high on many businesses' agendas at the moment. You have a low turnover, which impacts the bottom line. This means that you can retain the talent that you have, so you reduce the recruitment costs and training costs, and it also, with reducing the sickness absence, would also reduce costs there in lost time and productivity. So we're often asked what initiatives our clients could look at as part of their wellbeing strategies, and there are many initiatives which can be considered, and this would depend largely on your organisational needs and also resources. So there is really no panacea or no one-size-fits-all approach, and you'll need to consider which best fits your organisation. The initiatives offered, as we've said, will be unique to your company. So let's have a look at a few of the focus areas here. So having a look at a positive working environment. So within positive working environment, you could focus on a number of different areas. And for me, at the moment, flexible and/or remote working should definitely be on your agenda at the moment. It's a really hot topic, and your business approach to these requests is something that will have a huge impact in wellbeing. I don't know if you recognised it, but we certainly have across all our clients that people have had some sort of epiphany, or they've decided what they want to do, or how work fits in to how work and home life fits in for them. So 55% of businesses were expecting an increase in flexible working requests due to the pandemic, and we can definitely confirm that we have seen this actually present itself, if not more than that 55%. Additionally, for a positive working environment, as many jobs have evolved during the pandemic, it is also important to review job design and workload. So just picking up on workload, which I've mentioned there, this is another area that's been quite a focus for us, especially given recent times where many companies have made redundancies, often sometimes prematurely, and workload has since picked up. The recruitment is challenging, so this can lead to employees feeling quite overstretched and under an increasing amounts of pressure. So try to recognise the signs by evaluating workloads. You can do this by maintaining regular communication with the employees and offering support where required, so you catch that before they become sick. So positive working relationships. So this could include, for example, a review of your policies and working practices, things like your equal opportunities or your equality and diversity policies, and how your company deals with any concerns raised under these policies. You know, for example, it's no good simply reviewing your policies and working practices. You also need to ensure that this is followed and your managers have the support and training required to really embed this within your business. Also, for promoting positive working relationships, the employee voice is really, really important. So you can make sure you're utilising employee opinion surveys and you're not just scratching the surface and are really delving into the feedback you're receiving. You need to demonstrate that you're listening to your employees' feedback and difference. I did read the other day on the HR forum where a HR professional was asking for if anyone had differing names for an employee opinion survey. And someone commenting under the post that they'd heard employees refer to this as ask a question and receive no feedback or receive no answer. And whilst I did find this funny, it really highlighted to me the need to respond. So even if you don't agree or don't think that you can, you know, implement an initiative in response to their ideas or their feedback, do feedback to them and show that you've listened to it. Other examples here could be an employee forum, a focus group, or employee champions. And it's really important. Remember, your managers are your role models within the business, and they really do have a treacle effect. So it's ensured to get their buy-in in any initiatives that you want to implement. It is important to foster an environment where individuals feel that they can speak freely and raise any concerns that they have. Over to you, Laura.
Okay, so the next area is personal development. So training and development is a key point to give attention to in this area, particularly with many roles having evolved throughout the pandemic. We have definitely seen an increase in requests for training, and we're delivering more training courses than ever before. This is, of course, something which can only be of a benefit to your working environment, as it really shows your willingness to invest in your people. Personal development, of course, isn't limited simply to training courses. Other initiatives you could look at as part of this area are your one-to-one catch-ups with employees to ensure you're providing them with regular personal feedback, mentoring and coaching, providing your employees with training on aspects of financial well-being, and performance development plans as well. So next up, we've got promoting health. There's a vast number of initiatives which you could look at within this area. Now, the main one we see employers offering is the Employee Assistance Programme. Now, this is a great offering to have, but we must say that having spoken to our clients, when checking the uptake, it's often less than 5%. It's definitely still good to include as part of a wellbeing strategy, but we would encourage you just to ensure it's promoted and that people who want to or need to use it know about it and have the information readily available. Another point on the EAP is to remember it's not just there for employees struggling with their mental health. There's usually a range of other services provided, such as financial advice. So just make sure your employees know the different things they can use the programme for. Now, in recent years, we've also seen an increase in mental health first aiders. And this we have seen as a real benefit to many of the businesses we work with. Definitely another of the key pillars, and also a quick win. It's not only beneficial for employees who might be struggling with their mental health by providing them with the information and directing them to the support that they need, but it's also beneficial to the employees who attend this training and to the business, because this means that there's going to be more awareness around mental health, and that you've got people within your business who can look out for the signs that someone might need some support. Could we go on to the next slide, please? Thank you.
You've gone one forward now, Anna.
There you
That's
are.
it. Okay, so the company values. So do your company values align with what you actually do? I'll give you an example here, because this is a true one. So, for example, if one of your values is that you trust people, but then you have your managers checking how many times a team member goes to the toilet or what they're working on at all times, then you're not upholding the values of your organisation. So take time to consider how your company demonstrates that its values its employees' well-being, and how much it invests in both time and budget-wise. So CSR, corporate social responsibility, is all of this. Companies should think about how they integrate social and environmental concerns into their business operations and interactions with their stakeholders. So think about what the company does in this area, for example, food bank donations, charity work, volunteering, and or reducing carbon footprint. Believe it or not, these are many things that people value, and not just the bottom line or their paycheck. These things will help your employees feel proud of the organisation that they work for. Another consideration is how your company values diversity and inclusion. I know we've already spoken a little bit about the policies, but it's definitely important to mention here as well. We could spend a lot of time talking through all other benefits which could be gained from this, but unfortunately we don't have time to cover them all today. So reward and recognition. Here we're looking at things like pay reviews and gender pay gap reporting. So, like, what does your gender pay gap report show? For example, if it shows there is a large difference in pay rates between males and females, you should look at demonstrating the actions you're taking to address this. So employees who feel that they are being paid unfairly are not going to be won over by offers of free cake or pizza. If anything, this could make matters worse. Also, does your company have transparency on pay scales? This will promote fairness in pay and how people feel, and how bonuses are awarded. Is this something that's discretionary, or is there the criteria and something that's transparent and easy for people to see? Of course, non-financial recognition and smaller incentives is, of course, part of this, but ensure you get the main bits right here first. So for some of the other incentives, things like employee of the month, etc., are really good, but I can't stress enough how much it is to get the basics right first. Over to you, Laura.
Okay, so we've provided you with information on some of the different initiatives which can be offered, but where to begin with developing your own wellbeing strategy. So generally, these would be slotted into the three areas shown on the slide. So these are physical, psychological, and financial well-being. And as you can see, we've included some more specific focuses within each of these areas. Now, we would suggest picking up a couple of the initiatives which we've covered today within each of these focus areas. And this is just to make sure that you can invest your time and attention to make sure you can make a maximum impact rather than trying to approach everything in one go. So, for example, on review of the initiatives that you've already got in place, you might see that you've got a lot in place already around the psychological and social area, and this is often the largest focus focus area. So you might already have your EAP in place, your corporate social responsibility, regular opinion surveys, which are being reviewed. However, you might not have any initiatives in place around the financial area. So that might be your starting point. As always, it's important to make sure all of your strategies are aligned. So this includes your strategies for wellbeing, your people and HR strategy, and the wider business strategy. I know this point might be obvious, but you should also make sure you're including your short, mid and long-term goals. Some of the things we've mentioned today are, of course, much quicker wins than others. Now we've provided you with a suggestion on your approach to this, and we've set this out in a to-do list. So first of all, consider your business objectives. So for example, your business objective might be to reduce recruitment costs, and you've decided in your HR strategy that in order to achieve this, you need to reduce attrition. Now that would link in with your wellbeing strategy, where you can move on to identifying your focus area. So in this particular instance, you might look at focusing on your exit interviews. Other ways you could identify your focus area at this stage could be through an employee opinion survey or through focus group sessions, which we mentioned earlier. So point 3, engage employees in strategy development. This is throughout the development process and for evaluating its effectiveness as well. Our recommendation is to continue seeking feedback, and that's to make sure your strategy adapts to the changing needs of your employees and the business. Number 4, integrate your wellbeing strategy into your organisation. So get your ideas together, ready to present and move forwards with the management teams, which leads me nicely onto point number 5, which is bringing your management team on board. Again, I think we've mentioned it already, your line managers are the role models within the company, so their buy-in is really, really important. Making sure your line managers are on board with the initiatives means that they can engage with their teams about this and encourage their feedback and involvement. Of course, at this stage, don't forget to remind your line managers that in the long term, they're going to see improvements here. So that's to the health and well-being of their team members, which will result in the other benefits which we mentioned at the start of the slides, such as increased productivity. So point 6 is enlist wellbeing champions. Now, this point is more relevant to the physical focus areas and will not always be relevant in all initiatives. But it's just another point for you to consider there. And number 7, identify your wellbeing priorities. So here you will need to give consideration to the short, medium and long-term priorities which align with your overall business strategy and focus. So as any HR professional will know, you'll want some quick wins in there, and that's to demonstrate that the exercise is worthwhile, and we would suggest having some of these as a priority alongside the things which are going to take a little longer to show the benefits of.
Thank you. So next we're moving on to measuring the impact of your wellbeing strategy. And of course, if you're not measuring it, you're guessing and you can't demonstrate the impact and effectiveness of it. So you can see on screen here some of the areas that we would look to demonstrate an improvement. So there are many ways in which you can measure this, and when you're deciding how you're going to measure the impact and what you're going to measure, remember to go back to what you're actually trying to achieve with your strategy. So you're probably able to use data from your HR and or payroll systems to gather data for measuring information for things like absence levels, staff retention, so you can look at turnover, attrition. Employee productivity is one that we've mentioned a few times today. So if you have a method for measuring this, this provides for a good measure. For employee engagement and satisfaction, as we've mentioned a few times, you can gather information from focus groups and surveys. Many companies are steering away from the annual survey and now approaching this with more regular, shorter pulse surveys. So quite interestingly, I think for me, I would really want to see the difference in that and then adapt the strategy accordingly as you're moving along. I think that's a really good way. So running those quarterly, you can really see that the improvement and ensure that your strategy is effective. And that's it from me.
Lovely, thank you very much. So where are we now? We are coming to the end and the conclusion of the webinar today. But just as we said at the start, we'd now like to give you the opportunity to ask any questions. So we've got a couple of numbers of ways that you can do that. You can, of course, put any questions that you've got in the Q&A facility or the chat facility, or alternatively, please feel free to raise your hand and we can unmute your mic so that you can just ask the question physically. So I'll just give you a couple of minutes just to see if we have any questions that are coming in at all. It may be that you have got a question and you'd much rather take it offline, and if that's the case to do so, then please do reach out to any of us independently, or as we've already said, the contact details are up on the screen at the moment for Caroline and Laura, so you'll be able to get hold of them as well. So I can't see any at the moment, so on that hand, let's just move on and conclude today's session. So how can we help you? So we would love to give you a helping hand in any way that we can, not just around the contents of the webinar today, but we can also support you to deliver company HR policies and processes to support.
Anna, I can see a question, actually.
Oh,
I've just
okay.
spotted it. Sorry.
Yes, that's fine. You carry on.
I think this is one for you, Laura, if you've done this course. So it says, what do your mental health first aiders do if anyone goes to them?
Okay, so essentially your mental health first aiders are there to signpost employees to areas that they can get help. So it's not putting somebody in the position of giving any medical advice or anything like that, but they will be able to provide employees with a lot of information on different people that they can contact for support. It also means, so being a mental health first aider also means that you're able to spot the signs. So if you can see that somebody is struggling with mental health, it will enable that person to sort of start a conversation with them, and again, make sure they've got any support that they need.
Fantastic. We've actually got another question that's come in as well. So hi all, thank you for your time today. What is your current experience of how employees are managing / coping with a return to working in the office? Are you seeing any key issues?
So a lot of the companies, sorry, I'll pick this one up, Laura, because we've seen quite a lot, but many of our clients have kind of anticipated this and put in some hybrid working policies. For example, they would say that you've got to be in the office like 40%. Obviously, I'm talking about office environments here, but like 40% of the time, and they can manage that however they like. So they could do some mornings or afternoons or days, or do a week in the month, something like that. So that's how people have tried to head off either an influx in flexible working requests, or really people really pushing back on returning to the workplace. And I have seen one or two key issues, and that result to people with very poor physical health that are genuinely quite scared to come back to the workplace. And with those, we've taken them on a case-by-case basis. We'll talk through what measures that the client has got in place to protect people's physical health, but in all circumstances, sometimes it's probably easiest if we let those people work from home whilst the flu season at least gets over, because we have had quite a number of concerns to do with that. Have I covered your question, Richard?
Yes, thank you. That's great. Thanks very much.
Thank you.
Lovely, thank you very much. Definitely can't see any more questions coming in at the current time. So I'll just go back to saying how we can support you. So we've already said we can support you with anything within the content of the webinar today. We can help to support you with developing your company HR policies and processes to support wellbeing and mental health, deliver the training to your employees on these policies and processes if required, and deliver a HR and employee relations service to provide leaders and line managers with guidance and practical support to maintain employee and health and well-being. So just a couple of things left from me today. So firstly, just to say to you, we've got a couple of more webinars that are coming up. So just in the same way that we kind of publicise this one, this will be done in exactly the same way. So in November, we have a guide to interview techniques, and this will be all around competency-based interviews, as well as how you interview successfully in a virtual environment. We're going to give Christmas month the miss. So in December, we're all taking a break from our webinars, and then we'll be starting again in January with how to deliver an effective onboarding process for new starters. All that's left for me to say now is thank you very much. It's been a delight having you all with us this morning. If there is anything else that we can help you with, then please do just drop any one of us a line and we'd be more than happy to help you. And as I say, just once we've downloaded the information from the cloud, we'll also send a copy of all of this out to you. So thank you very much and enjoy the rest of your days.
Thank you.
Thank you.